Welcome back to the next Appraisal Tool modules. This module addresses question 1. Is the problem clearly described? Scientific articles typically begin by the researcher describing the problem that the study intends to address. Often the problem is based on a clinical concern, an etiology of a health issue, need for a prevention or a treatment, issue about quality, whether it be processes or outcomes, or efficiency of an organization. There are key components of a research problem. Significance refers to the importance of the study to address the problem. The author is expected to develop a justification for why the study is needed. Why is this a problem that needs to be addressed? An author should address the general contribution the study will make on the well-being of people, systems, organizations, and others. Well-developed problem statements can also answer several questions. Who does the issue affect? How many individuals are affected? How long has this been an issue? How expensive is the issue? Is a disproportionate amount of funding spent on this issue? What is the current controversy or debate about this issue? To describe the extent of the problem, authors can use startling statistics to emphasize the importance of conducting a study to tackle the issue. For example, 1 in 3 pregnant women gains excessive weight during pregnancy, increasing the risk of maternal and infant adverse outcomes. Or, premature birth costs $26.2 billion annually in the United States. Both of those statements help you understand the problem. The author should also briefly summarize the current body of knowledge, what is known and what is not known about the topic of interest, and then clearly articulate the gap. What information is still needed? Overall, by describing the problem and the gap in the knowledge, the author should be developing a rationale for allocating resources, not only to the problem, but to this specific study. You should be convinced that the evidence generated by the study can be used to make a difference. In contrast to a well-constructed problem, poorly developed problems make it difficult for the reader to follow the author's logic and to recognize the problem and the gap. Remember, just because an article is published in a peer-reviewed journal does not guarantee it is well written. Here are some example phrases that might be used in the sentence that helps the reader identify the gap. For example, there's a dearth of evidence about, little is known about, few studies have explored, findings from previous studies conflict, or evidence is inconclusive, or the intervention has not been tested, and then they'll tell you their population of interest. When formulating an appraisal response to this study, the answer is yes. The problem is clearly described. The researcher reports the extent of the problem of hopelessness among this particular patient population. They also clearly describe the importance of the research to inform nursing practice. Congratulations! You successfully completed this module. You may return to the main menu or continue to other appraisal modules in the next EBP course.